Hello friends, welcome to my two channels. Hope you are safe and doing good. And basically today I am just uploading the video regarding the one of the most important topic in pathology, that is the hypertensions. And if you see that many of the people right now in many countries, not only in India but in especially in USA, there are more persons that are affected in what they're suffering from the hypertension. So okay, let's start the hypertension topic. And of course you have to see the full video if you want to have the control concept, or if you want to have the good concept regarding hypertension. Please watch the full video, okay, without cutting anywhere. Okay, hope you will see. Let's start. I'm starting the physiology of hypertension, guys. Okay, so pathophysiology of hypertension, it's one of the most important topic, because you know that many of us in our family, of course you can see also they're also suffering from hypertension. So basically what, guys, hypertension is nothing but what we know, that increasing blood pressure. So if you see in the good words, that elevated blood pressure in the systemic arterial circulations. Okay, but one more thing. Okay, the hypertension can be caused in the pulmonary also. In the pulmonary there should be there, but we have to specific after then. Otherwise you cannot say. If we just talk in general hypertensions, then of course we have to understand that what the elevated blood pressure in systemic arterial circulations. But if you talk about the pulmonary hypertension, then you have to say what, there is the increase in the blood pressure of what in the pulmonary. There is a specific. Okay, so let's write here what is our hypertensions, that is elevated blood pressure. I'm writing here BP means blood pressure, take it as elevated blood pressure in systemic arterial circulation. Okay, guys, now what did I say, that hypertension is basically maybe for two types, like in general, like it may be for the systemic, or if I can say that systemic circulation hypertension, on it may be like the pulmonary. But whenever, guys, I'll just say the pulmonary, but I have to specify at the time I have to specify that it's the pulmonary. But if I just talk about normally the hypertension, then I have to understand there's the nothing but the systemic arterial hypertensions. Okay, now the blood pressure, this basically depends upon many factors, like it may depends upon what age, okay, height, color, many things are there. Okay, anyway, so basically, guys, you know that in the hypertensions, of course, you know that the two types of the pressures. One is called the systolic pressure, and is the diastolic pressure. And we know it only also, of course, that was the systolic pressure, not as the diastolic. Whenever the heart will contract, whenever the heart will get contracted, at the time of the systole, and whenever it will come in the relaxation, it is called diastole. It is called diastolic pressure. So systolic pressure means what, guys? So you can consider it here with the systolic and diastolic pressure. Okay. So systolic and another is diastolic. Now, guys, whenever the systolic pressure, when we will say it's, when we will consider that it is the person is having hypertension. It's very important also. In many books we will see many things, but I'm just giving an average idea. Okay, an average calculations. Okay, is 140 mm of mercury, and at the diastolic we just take how much? Here about 90 mm of Hg. Now, why? You can ask why we are taking these values. Okay, why we are taking this as cutoff? Why the cutoff is what? The cutoff has been taken as standard. Has been taken as standard because what? Because most of the persons, it has been seen, or you can say it has been found it has been found what, that the persons, it has been found the persons with the persons with what, more than more than 140 mmHg of 140 mmHg of what, the systolic pressure, and more than 90 mmHg of diastolic pressure, what, are having are having are having what, risk of cardiovascular complications. So cardiovascular complications, we can say here, cardiovascular complications. That's why guys we take it as standard form, because it has been seen especially in case of US, but of course in India it's also seen. Now guys, there is one more thing that we have to understand, that what, we can think that this is the systolic blood pressure, this is the diastolic blood pressure. Now if I ask you which one is the more dangerous, the systolic or diastolic, of course you can say many things, but let me tell you which one is the correct here. The systolic hypertension is the more dangerous. The systolic is very very important, just you can remember here. So it's systolic, I'm writing in red pen. The systolic BP is more dangerous. It's most, more dangerous. Why? Because they, okay, because it leads, I'm right, because it leads to left ventricular hypertrophy. Left ventricular hypertrophy. For suppose guys, if I just consider this as the heart, just assume, okay, and what will happen in the left heart, there will like extra growth here, hypertrophy. And whenever we will have the in the left ventricular hypertrophy, at the time what will happen, the cardiovascular complications will be found here, the cardiovascular complications. So that's why what, the systolic blood pressure, whenever this, it's more dangerous than the what, the diastolic blood pressure. So it will just lead what, the cardiovascular complications, we can say. Cardiovascular complications, it may be many things. Complications. Okay guys. Okay, I'm just writing in the next page. Now, one more thing you have to know that about the symptomatic. Okay, so first of all, guys, if someone is having hypertension at the early stage, you cannot understand that I am having hypertension. So in the early stage, it is asymptomatic. Okay, in the early stage, it is asymptomatic. Hypertension at early stage is asymptomatic. So you have to write what, that I'm writing hypertension. Normally, HT means hypertensions. At early stage, it's what? It's asymptomatic. Is asymptomatic. Asymptomatic. At early stage, is asymptomatic. Now what? The system. Now you can ask me when the symptoms will appear at the time. Okay. Now the symptoms will appear when at the end organ damage. It's very very important. The terms end organ damage. Okay. We can write the symptoms will appear. The system. The symptoms will appear when at end organ damage. At end organ damage. Now it's also important that what do you mean by the end organ damage? Is the end organ damage. Now guys, end organ damage means basically the 5 vital organs in our body. Whenever we will just get affected with the hypertension, at the time what will happen? The organs, there is chances to get affected. There is chances to get something will be wrong within those organs. Basically the most 5 vital organs, and those five vital organs what? Okay, first this is the heart. I'm writing it. First organ, this is the heart. And within the heart, what the complications may be there? There may be ischemic heart disease. Ischemic heart disease. Okay, guys. Then what we can have? The congestive heart failure. We can also. Congestive heart failure, guys. The complications may be regarding what with the heart. Then we are having what in the CNS, in the central nervous systems. There may be the complication within the CNS. So maybe what? There may be the cerebral stroke. Cerebral stroke. Now guys, we have to understand the terms with stroke. Stroke means nothing. Stroke means, first of all, within the central nervous systems, if there is some dysfunction due to the lack of the blood. Okay, first of all, stroke means what? Stroke means dysfunction of CNS to lack of blood. Then there will be what? There is developing neurological disorders. Okay guys, at the time what will happen? And if this continues, if this things continues less than 24 hours, if it is continuous less than 24 hours, then we will call it as transient ischemic disease, or you can say transient ischemic attack. And if it lasts for more than 24 hours, if it lasts for more than these things, more than 24 hours, then it will what? It will just ultimately lead to what happen? The stroke. That at the time it will be stroke. Then guys, in case of, you can say, kidney. In the kidney, therefore the blood vessels, we can have the chances to get affected with the what? Nephropathy. Okay guys, then we're having what? Blood vessels. Now guys, within the blood vessels there are some complications, and you have to know the complications that may lead to what? The atherosclerosis. Okay guys, and of course one more organ that is very, very important, that is eye. And within the eye there's what? Retinopathy. The complications regarding with the retinal. So there may be what? Retinopathy, guys. Okay, now I'll just give you a, the stages of the hypertensions. There are some stages by which you can just understand that the person is having, or the person is will have the hypertension the before the stage of that, and whenever the person is in the hypertension stage already, or he's not in that. So we have to consider by measuring some of the values. So you can also give the values here. That what the stages of hypertensions. Now guys, first stage, that's called the pre-hypertension. Pre-hypertensions. Then guys, hypertension stage 1. Then hypertension stage 2, guys. Then one more classification, there is malignant hypertension. Malignant hypertension, guys. Now we have to know when at their values, at the systolic as the diastolic values here. Okay guys, here. So we have to know the systolic, the systolic blood pressure and the diastolic pressure. But whenever we are having the it's not actually the hypertension, but before the hypertension. That means the person may have in future, but he's not having right now. So what the its range what from 120 to 139 mmHg, the systolic maybe, and the diastolic will be from 80 to near out 89 mmHg. And at the time we have to alert the person that you may have in future. So just be alert. We have to alert the person to be alert. And in stage 1, guys, what the hypertension stage 1, the person who is having what, and for the pre-hypertension, we have to alert the person to change his lifestyle, of course. And we have here in the hypertension stage 1, 140 to 159 mmHg, guys. And of course here in the diastolic pressure of 90 to 90 mmHg. And he needs to have some drug, he needs to have some medications to control his blood pressures or her blood pressures here. Okay, then we are having what, the hypertensions regarding the hypertension stage 2. It's more dangerous here. So it will be always more than 160 mmHg here. And what about it will be more than 100 mmHg, the last place. Okay, and guys, of course, and the malignant hypertension is the most dangerous here. And this stuff is not like the cancerous things. It's looking like the malignancy, but don't think it's like the cancerous. The malignant, hypertension means whenever the severe condition is the severe hypertension, That means what? We can say whenever the blood pressure will be not within the range to control it. Okay, so it will be out of range. At the time, if you can consider, this one will be more than 120 mmHg. This one, the diastolic blood pressure at the time. We cannot save the patients, and most of the patients they get die within 1 year, because most dangerous here. Okay, guys, now you can take the chart, you can have the screenshot from here. And now, guys, I'll just tell about the hypertensions. This basically two types. One is the essential hypertension, one is like essential or primary hypertension. Essential or primary hypertension, and another is secondary hypertension. It's guys secondary. Now, essential or primary hypertension, that means what? First, suppose the guys, it's for suppose I am having the hypertensions, and for it in my office rings, the same thing can go there, because it can affect also them. So it may be what, the inheritals we can say by inheriting or environmental factors, Okay, and guys, the secondary hypertension, that means what? It's for any type of the disease. Okay, we can also consider it here. It's for for suppose any tumors, or for any type of the things, the blood pressure is getting increased, or hyperparathyroidemia. So any things like this, that will just lead to what, the increase in blood pressure for its like specific disease for it. Okay, now what will happen at the time? What can we say? And this is like we can get curable by removing the cause of disease, but guys, this is not you can't cure. It's not curable, guys. It's not curable, because what, it's the inherited, and of course the environmental factors here, so we cannot cure it. And we have to use our medications here to control, but we cannot get the complete cure here, but here we can get the curative wire in the secondary hypertensions. Okay, guys, and I'll just tell in the next things in the next videos. Before that, please support me, guys, and subscribe my channel if you're just watching for first times, and to subscribe. And I'll upload in the next the stage 2. This was all about the stage 1 of the hypertensions, and the next videos I'll upload the things that will be regarding the hypertensions, their complications, their actual pathophysiology there. So just like the videos and comment, just have the comments if you don't understand anything regarding my handwriting, because it's not good here. So if you don't understand anything, just let me know in the comment section. I'll try to help you. Okay, guys, see you in the next video. Stay safe, stay healthy.